When was the last time you really looked at your fingernails? Not to check if they need trimming, not to see if there's a chip in the polish. Really looked at them. The shape of the fingertips, the color beneath the nail, whether the surface is glossy smooth or crossed with ridges. Most of us never think to look, and that's completely understandable. The nails are easy to overlook, but here's something that might genuinely surprise you. Physicians going back all the way to Hippocrates in ancient Greece understood that the fingernails carry information not just about the nails themselves, but about what's happening deep inside the body. In the heart, the liver, and yes, the lungs. The medical examination hasn't changed much in that regard. When a doctor sits down with a patient for the first time, checking the hands and nails is still part of what they do. Not because it's ritual, but because it works. Today, we're focusing specifically on 7 changes in the fingernails that have a documented medical association with lung disease and in some cases with lung cancer. And I want to be upfront about something before we begin, because this is important. Every single sign we're going to show you today has other causes. Many of them are far more common and far more benign. Seeing one of these changes does not mean you have cancer, not even close. What it does mean is this: pay attention, mention it to your doctor, let someone with the right tools investigate. Because here's the other thing worth knowing. Lung cancer is the leading cause of cancer death in both men and women. More Americans die from it each year than from colon, breast, and prostate cancer combined. And part of what makes it so deadly is how quietly it can develop. In the early stages, there's often no dramatic cough, no pain, no obvious weight loss. Nothing that makes a person think, I should call my doctor. That's precisely why a sign that shows up somewhere as accessible as your fingernails matters. These small, keratin-coated structures at the ends of your fingers are, in a sense, windows, and today we're learning to look through them. Stay with us through all 7. By the time we're done, you'll know what to look for, what it might mean, and exactly what to do if you see it. That knowledge could matter more than you realize. Let's begin. Sign 1, digital clubbing. The first sign, and the most important one on this entire list, is called digital clubbing. This is the nail change that physicians are specifically trained to look for when they suspect lung disease. Once you know what it looks like, you'll recognize it immediately. On yourself, on someone you love, on anyone. Here's what's normal first. If you look at a fingernail from the side, hold the finger up and look at the profile. There's a small, natural angle between the base of the nail and the skin of the finger. That angle is typically less than 180 degrees, like a very gentle, gradual slope. The fingertip itself has a firm, defined shape. In clubbing, that changes. The soft tissue just beneath and around the nail begins to slowly swell and thicken. The nail itself starts to curve downward and around, like it's wrapping around the end of the finger. The fingertip becomes enlarged and rounded, taking on a shape that doctors often compare to an upside-down spoon or to the end of a drumstick. The nail base loses that normal angle and often pushes past 180 degrees, creating a distinctly bulbous appearance. There's a simple test you can do right now. It's called Shamroth's window test, named after the South African cardiologist Dr. Leo Shamroth, who described it using his own hands during an illness. Here's how to do it. Press the thumbnails of both hands together, nail to nail, with your fingertips pointing toward each other. If clubbing is absent, if your nails are normal, you'll see a small, clear diamond-shaped gap between the 2 nail bases where they meet. You can see light through it. Now, if clubbing is present, that gap disappears. The nails press completely flat together with no space between them. Try it right now. Write down what you see. The reason clubbing happens is tied directly to how the lungs function. When the lungs aren't working properly, whether because a tumor is obstructing an airway, fluid is building up around the lung, or disease has compromised lung tissue, the body's ability to deliver oxygen to the blood suffers. This drop in oxygen appears to trigger the release of growth factors, particularly one called vascular endothelial growth factor, or VEGF. These factors cause the blood vessels in the fingertips to dilate and the surrounding tissue to thicken and accumulate over time. The result is the characteristic bulbous fingertip. How common is this in lung cancer? Studies vary somewhat, ranging from about 5% to 35% of lung cancer patients, depending on the type and stage. But here's what makes clubbing especially significant. When it occurs in association with lung disease, lung cancer accounts for the majority of those cases, and perhaps most important of all, clubbing can sometimes appear before other symptoms, before the cough becomes noticeable, before the shortness of breath is obvious. It can arrive early, when treatment is still most effective. One more thing worth saying, clubbing doesn't develop overnight. It's a slow, gradual process, which is part of why it so often gets missed. People adapt to the way their hands look. They don't notice the change because it happens incrementally, over months or even years. So take a moment today to really look at your fingertips. Compare both hands. Try the Shamroth's test. If something seems off, if the tips look rounder than you, remember. If the nails seem to curve more than they once did, take a photo, note the date, and bring it to your doctor's attention. This one is worth knowing cold. Sign 2. Yellowing and thickening of the nails. The second sign involves a specific pattern of nail discoloration, and it's more distinctive than it might initially sound. Most of us have seen nails turn yellowish at some point. It happens with certain nail polishes, with prolonged antibiotic use, and most commonly, with nail fungus. None of those are what we're talking about here. What we're referring to is a recognized medical condition called yellow nail syndrome, a rare but real disorder that most commonly appears in people over 50 and has a well-documented connection to the lungs. The syndrome was first formally described in the 1960s and has been confirmed in medical literature through the present day. In yellow nail syndrome, several things happen to the nails simultaneously. They turn yellow or yellow-green. They become noticeably thicker and harder. The natural shine of the nail surface diminishes, and perhaps most distinctively, the nails begin growing significantly more slowly than normal, sometimes almost appearing to stop growing altogether. They may also develop an increased curvature, both lengthwise and from side to side, and in some cases, the nail partially separates from the nail bed at the tip. The connection to the lungs runs through the lymphatic system, the network of vessels responsible for draining fluid from tissues throughout the body. In yellow nail syndrome, this system appears to be impaired. When lymphatic drainage fails, fluid builds up, and in the chest. That can mean a condition called pleural effusion, the accumulation of fluid in the space between the lung and the chest wall. Research has found that approximately 2 out of 5 people with yellow nail syndrome develop pleural effusion. Chronic cough is even more common, present in the majority of those affected. Bronchiectasis, a condition in which the airways become permanently widened and damaged, is also frequently found. Where does lung cancer fit in? Yellow nail syndrome is considered a paraneoplastic syndrome, meaning it can occur as an indirect effect of cancer elsewhere in the body, including lung cancer. It has been reported in association with various malignancies, and when it appears alongside lung symptoms in an older adult, it is taken seriously by physicians. An evaluation will typically include chest imaging. Now, the important caveat: yellow nail syndrome is rare. If your nails are yellow today, the far more likely explanation is nail polish, a fungal infection, or certain medications. Fungal infections tend to be more localized, starting with one nail, sometimes crumbling at the edges. Yellow nail syndrome tends to affect multiple nails more uniformly, progresses slowly, and is accompanied by the other features described: thickening, slow growth, and often lung or lymphatic symptoms. If you suspect something beyond ordinary nail discoloration, particularly if multiple nails are affected, if growth has slowed noticeably, if you have a persistent cough or any leg swelling, that combination deserves a proper evaluation. It's a conversation worth having with your physician. Sign 3, blue or purple nail beds. The third sign is one you can check in under 30 seconds, and if you see it, it warrants prompt attention. Your nail beds should be pink. That color comes from healthy, well-oxygenated blood flowing through the tiny capillaries just beneath the surface of the finger. When blood carries adequate oxygen, it's bright red, and through the translucent nail, that reads as a healthy rosy pink. When oxygen levels fall, the picture changes. Blood that hasn't been fully oxygenated takes on a darker, bluish-purple tone. The hemoglobin, the protein that carries oxygen, looks different when it's depleted. And that difference becomes visible in the nail beds, in the lips, in the fingertips themselves. Doctors call this cyanosis, from the Greek word for dark blue. In central cyanosis, where both the nail beds and the lips and tongue are affected, the issue is a systemic drop in blood oxygen levels. The lungs are failing to oxygenate the blood adequately. For someone with lung cancer, this can happen when a tumor blocks a major airway, when fluid accumulates around the lung and compresses it, or when extensive disease has compromised so much lung tissue that gas exchange becomes inadequate. Here's a quick home check. Press firmly on your thumbnail for 3 to 5 seconds, then release. When you press, the nail bed should turn pale. You're pushing the blood out temporarily. When you release, that pink color should return quickly, within about 2 seconds. This is called capillary refill, and it's a standard assessment in clinical medicine. If the return is slow, taking 4 or 5 seconds or more, or if the nail beds look persistently bluish, grayish, or purple rather than pink even at rest, that's a sign worth taking seriously. One important distinction to keep in mind: hands can look bluish temporarily when they're cold, because blood vessels near the skin constrict to conserve heat. That's called peripheral cyanosis and is typically harmless. What we're describing here is persistent discoloration, bluish nail beds that don't resolve when you warm up, that are present at rest and at comfortable temperatures. If you notice that your nail beds consistently look darker than they should, and especially if you've been experiencing any breathlessness or fatigue, let your physician know. For those of us over 60, this kind of change is sometimes written off as just circulation or attributed to getting older. Don't dismiss it. A persistent change in nail bed color has meaning. Ask for it to be evaluated. Sign 4. Pale or white nail beds. The fourth sign is the opposite of what we just covered, and it points in a different but equally important direction. Instead of a blue-purple discoloration, this sign involves unusual pallor. The nail beds become pale, noticeably lighter than they should be, sometimes nearly white, when they ought to be a healthy pink. Pale nail beds are classically associated with anemia, a reduction in the number of healthy red blood cells, or in the hemoglobin those cells carry. And here's where this connects to lung cancer. Anemia is one of the most common systemic effects of malignancy. It can develop through several mechanisms. The cancer may interfere with the bone marrow's normal ability to produce red blood cells. There may be internal bleeding, sometimes slow and hidden from a tumor eroding blood vessels or irritating tissue. The body's inflammatory response to cancer can also suppress red blood cell production, a phenomenon called anemia of chronic disease. There's a simple way to check for this at home. Look at your nail beds, then gently pull down the lower eyelid and look at the inner rim. In a well-nourished, healthy adult, both should show a clear pink-red color. If both your nail beds and your inner eyelid rim look pale or washed out, that's a classic clinical finding that points toward anemia. One physicians still use as a quick initial assessment. Anemia has many causes, and most of them are common and treatable. Iron deficiency, vitamin B1, 2, or folate deficiency, kidney disease. A simple blood count will reveal it. But in an older adult, where the cause isn't immediately obvious, where iron levels aren't explained by dietary deficiency, or where anemia persists despite supplementation, the deeper question of why matters enormously. A cancer-causing slow, occult bleeding can deplete iron reserves gradually over months, and the pallor in the nail beds may be one of the first visible signals. There's also a related condition called Terry's nails, where most of the nail appears white but with a narrow pink band near the tip. This pattern is associated with liver cirrhosis, heart failure, and diabetes again. Systemic conditions that reflect something significant going on in the body, even if not always cancer. Don't dismiss unusually pale nails as just how they look. They're telling you something about your red blood cell status. A conversation and a blood test can clarify what, quickly and easily. Sign 5. Beau's lines. The fifth sign is one of the most fascinating from a medical standpoint because it functions almost like a timestamp on your nail. Look at your nails closely. Do you see any horizontal grooves, dips, or indentations running across the nail? not along its length, but cutting across it from one side to the other, like a groove in a record. That's called a Beau's line, named after the French physician Joseph-Honoré Simon Beau, who described the phenomenon in the 19th century. Here's how it forms. Your nails grow continuously from a small, crescent-shaped structure at the base of the nail called the matrix. The matrix is sensitive to what's happening throughout the body. When the body experiences a significant physiological disruption, a serious infection, a high fever, major surgery, severe malnutrition, a toxic medication, or a systemic illness, the matrix can temporarily slow down or stop nail production. When normal growth eventually resumes, the interruption leaves a physical mark, that horizontal groove pressed into the nail plate. And because nails grow at a fairly predictable rate, roughly 3 to 4 millimeters per month, a Beau's line carries information about when the disruption happened. If the groove is 12 millimeters from the base of the nail, you can estimate the stress occurred roughly 3 months ago. Beau's lines are not specific to cancer. They can appear after a bad flu, following a hospitalization, or after any period of intense physical stress on the body. But here's where they become relevant to our topic today. In patients who are later diagnosed with lung cancer, Beau's lines have sometimes been traced back to the period when the disease was silently progressing, before any other symptoms were noticed. The body knew something was wrong even when the person did not. Beau's lines are also commonly seen in patients undergoing chemotherapy, where powerful medications disrupt rapidly dividing cells, including the nail matrix. A single Beau's line on one nail, in isolation, is far less significant than lines appearing simultaneously across multiple nails at the same position. When multiple nails are affected at once, that points to a body-wide event, rather than a localized injury to one finger. If you notice horizontal grooves crossing several nails at approximately the same point, and you can't trace them to a specific known illness or injury, that history, that timestamp is worth bringing to your physician's attention. Sign 6. Splinter hemorrhages. The sixth sign is one that's easy to see under good lighting, but easy to overlook if you don't know what you're looking for. Hold your nail under a bright light or near a window. Look underneath the nail plate, not at the surface, but at the skin beneath it. Do you see any thin, dark lines running vertically? Lines that are narrow, reddish-brown, and run lengthwise, like a splinter lodged under the nail. Those are called splinter hemorrhages, and the name describes exactly what they are. They form when tiny capillaries in the nail bed rupture, allowing a small bleed to occur in the narrow channels that run along the length of the nail. Once that blood dries and darkens, it becomes visible as a thin, longitudinal dark streak. The most frequent cause by far is minor trauma. If you bang your hand against something or do a lot of work with your hands, capillaries can break. Splinter hemorrhages from trauma are common, typically limited to 1 or 2 nails, and they resolve on their own. What's more clinically significant is when splinter hemorrhages appear across multiple nails without any obvious trauma history, and especially when they keep recurring. In those cases, they can point to something systemic. Classically, they're associated with bacterial endocarditis, a serious infection of the heart valves. They also appear in vasculitis, in autoimmune conditions like lupus, and in certain blood clotting disorders. In the context of malignancy, splinter hemorrhages can result from what physicians call paraneoplastic phenomena, indirect effects of cancer on distant tissues, sometimes mediated by the immune system, or by microscopic emboli traveling through the bloodstream. This association is less direct than some of the other signs on our list, but it is documented. The key question to ask yourself is this: are these appearing in multiple nails without a plausible explanation? Are they recurring? Are they appearing alongside other symptoms, breathlessness, fatigue, a persistent cough? If yes, don't assume you bumped your hand. Flag them. Sign 7. Spoon-shaped nails, Coralinicia. The 7th and final sign on our list is one of the most visually distinctive once you know to look for it. Healthy nails curve gently outward and downward over the tip of the finger in a condition called Coralinicia. From the Greek words for hollow and nail, that curve reverses. The nail becomes concave, scooping inward rather than curving outward. If you were to place a small drop of water in the center of the nail, it would sit there like a bowl rather than roll off. Coralinicia is a classic sign of iron deficiency anemia. When iron levels fall critically low over a prolonged period, one of the ways the body makes that visible is through this distinctive change in nail shape. Now, why does this matter in the context of lung cancer? Iron deficiency in adults doesn't just happen from not eating enough red meat or spinach. One of the significant underlying causes, especially in someone whose diet hasn't changed, is chronic blood loss. Tumors can bleed. A lung cancer that erodes a blood vessel or repeatedly irritates tissue can cause small, recurring bleeds. That blood gets expelled from the body, sometimes visibly in the sputum, sometimes in such small amounts that it's entirely invisible. Over weeks and months, these losses deplete the body's iron stores. Hemoglobin falls. The nail matrix, deprived of adequate iron and oxygen, responds by producing nails with that characteristic concave shape. So koilonychia, in this context, can be a downstream signal from a process happening in the chest, a process the person may have no other obvious awareness of. Again, the vast majority of spoon-shaped nails in adults trace to straightforward nutritional iron deficiency or absorption issues. But in a person whose iron levels keep dropping without a clear dietary explanation, whose anemia doesn't improve with supplementation as expected, or who has other symptoms in the picture, that unexplained iron loss demands investigation. The source of the deficiency matters as much as the deficiency itself. If you notice your nails developing an inward scoop, particularly if it's developed recently in adulthood and isn't something you've had your whole life, bring it to your doctor's attention along with a request for iron studies. What to do and how to think about all of this. We've just covered 7 nail changes that have real, documented associations with lung disease and lung cancer. That's a lot to take in. So before you go, let's be honest and grounded about what it all means. First, most people who have any of these signs do not have lung cancer. Clubbing can come from decades of COPD or cardiac disease. Yellow nails can come from nail polish and ordinary fungal infection. Pale nail beds may mean you need more iron and leafy vegetables. Beau's lines may mean you had a serious illness 3 months ago and forgot about it. The context is everything, and that context requires a professional to assess. Second, these signs don't diagnose anything. They are signals. Your body whispering that something might be worth investigating. The right response to a whisper is not panic, it is listening. Third, one sign in isolation means less than a cluster of signs together, especially when symptoms are also present. If you notice clubbing alongside a persistent cough you can't explain, alongside fatigue that seems out of proportion to your activity level, and perhaps some unexplained weight loss, that combination carries more weight than any single finding on its own. So here's what to actually do. Look at your nails today. Right now, if you'd like. Hold your fingers under a good light. Check the shape of your fingertips and try the Shamroth's window test with your thumbnails. Check the color of the nail beds. Are they pink or pale or blue tinged? Look for horizontal grooves crossing multiple nails. Look for thin vertical lines beneath the nail surface. Does anything look unusual or different from what it was a year ago? If something concerns you, take a photo of it. Write down when you first noticed it. Write down whether it seems to be changing. That documentation is genuinely useful in a clinical setting, where a physician is trying to understand timeline and progression. Then call your doctor's office, not as an emergency, but as something worth evaluating. Show them the photo. Describe what you've noticed. Ask for it to be assessed. A thorough physician will examine it in context, ask about accompanying symptoms, and order relevant blood work or imaging as appropriate. And one more thing. If you're over 55 and have ever smoked or have a significant history of secondhand smoke exposure, please ask your doctor about low-dose CT screening for lung cancer. Current guidelines recommend this screening for many people in that risk category, and the evidence for its effectiveness in catching early-stage disease is strong. It's one of the most powerful tools available for catching lung cancer before it becomes the problem that it too often is. The message of today's video is not fear, it is awareness. Lung cancer caught in its earlier stages has dramatically better outcomes. The challenge has always been that the early stages often hide. There's no pain, no dramatic symptom, Nothing that shouts something is wrong. But sometimes, the body leaves quiet evidence in the most unexpected places. At the ends of your fingers, in the color of your nail beds, in the shape of a fingertip that used to look different. Now you know what to look for. If this video helped you, please share it with someone you care about. A parent, a sibling, a friend who would never think to check their nails for something like this. And if there's a health topic you'd like us to cover next, leave it in the comments. We read them all. Take care of yourself. Your body is working hard every day to give you information. Today, you learn to read a little more of it.